So I'd like to welcome all of you to our third Foot Care Nurses Forum dialogue and discussion, and you're all very welcome today. So what I'd like to do is just run quickly through the agenda, and then we'll do some introductions of those that are on the call today. But before I do that, I just want to confirm, Melissa, you can see my screen and you can hear me okay?
Yep, I hear you very clearly and I see your screen.
Okay, super. So after we do welcomes and introductions, we want to just have an opportunity for some of our provincial and national foot care associations to share some of their work with you in terms of supporting you in your work as foot care nurses across the province. One of the things that we do want to redo is have a good final look at the overview of our documents that we've been working on over the past month. And I'll talk a little bit about how we got to where we are today, but it's now called Essential Considerations During COVID-19 for Foot Care Nurses in Various Settings, Preparing to Return to Practice. So it's a very long title. But I do want to thank all of those that have contributed. We'll recognize them shortly. We'll take some time for questions and answers, and if we can, we'll do that throughout the review of the overview document, and then we'll talk about closing and next steps. So just in terms of the RNAO team, and I'm not sure if they can put their cameras on so you can see them or not. You should be able to see me, but there's myself, Heather McConnell. I'm the Associate Director for Guideline Implementation and Knowledge Transfer at the RNAO, and I'm going to ask Bev to introduce herself.
I can't, yeah, I'm here, Heather. Sorry, I was trying to start my video, but it won't start. So that's okay. I'll just say I'm Bev Fulbear, Long-Term Care Best Practice Coordinator with the RNAO. And I've been in my role for many, many years. And I support the implementation of best practice in long-term care homes from Windsor to west of London.
Great. Thanks so much, Bev. And Catherine.
I think Catherine is having some technical issues logging on.
Oh, okay.
So I will just go and introduce myself. So hi, everyone. My name is Melissa Azes. I am the project coordinator in the IABPG Center, and I also work with our international best practice spotlight organizations.
Great. Thank you, Melissa. So this is the RNAO team that started this work. And now I'm just going to introduce colleagues from a few different organizations. So we have Audrey Wall and Pat McDonald are on with the Canadian Association of Foot Care Nurses. Can we just confirm that we can hear both of you? And maybe you'd like to say a little bit about yourselves, Audrey and Pat?
Hi.
Maybe Audrey first.
Yeah, hi Heather, this is Audrey, and thank you for having CAFCN participate. I am a foot nurse in Southern Ontario and the president of the CAFCN, and honored to be part of this group providing such really great collegiality and intersectionality work for foot nurses across the country.
Great, thanks Audrey. And Pat, do you want to introduce yourself?
Hi there, it's Pat. I'm the past president of the CAFCN and I'm in Winnipeg.
Okay, great. So you're a couple hours behind us then. Okay, well, welcome to you. And then we've got some representatives from the Ontario Podortho Nursing Association. So maybe Erin, I know you're on the line. Maybe you could go first.
Hi, I'm Erin King. I'm the president of the Ontario Podortho Nursing Association, also known as OPNA. We represent our members in the Ontario region, and I'm happy to be here with you today.
Great, and I think you've got some colleagues with you too. So Heidi, can we hear from you?
Hi, how are you, Heather?
Well, thank you.
So I'm Heidi. I'm the Vice President of OPNA and Ethic Director, and we're happy to be here today. So thanks for having us.
Thank you. And Sareb.
Yes, hi, I'm Sareb Dormani, registered nurse and a Podortho nurse here in Ottawa, Ontario, and I'm very delighted to be part of the panel today.
Great, thank you. And Cindy.
Hi, good afternoon. I'm Cindy Bilarjan. I am the secretary with OPNA, and I worked in the community for quite a while, so I'm quite familiar with the struggles that some of the nurses might be having.
Excellent, thank you, Cindy, very much. Yeah. So we got some good representation from different sectors on the call already. And then Rami, we've met Rami in past meetings, but Rami, maybe you could go ahead and introduce yourself. You just need to come off mute.
Oops, can you hear me?
I can, thank you, go ahead.
Oh, hi, hello, Heather. Thanks again for having me
Yep,
again.
absolutely.
although I'm here, I have a couple of my other advisors as well that is also in on this call. My name is Romy Burgess-Burfett, and I am the president of the Foot Care Nurse Certification Board. So we also have Jane Manna, who is, she's in this call as well.
Okay,
so chatting with you later on.
Okay, super. Thank you very much. And Catherine's been able to join us from the RNAO team, so maybe she can introduce herself.
Yes, hi. Thank you, Heather. Sorry for the
No problem.
earlier.
No problem.
My name is Catherine Jewell, and I am a nursing policy analyst at RNAO.
Great. Thanks, Catherine, for joining us. So this is fabulous. So we've got a great group today, and I just wanted to kind of remind everybody how we got here. We've got almost 100 people on the call right now, and about a month ago, actually, just less than a month ago, we realized that we were getting a lot of questions from foot care nurses to Doris Grinspoon directly, our CEO, through her regular updates. People were directing questions to her, or they were coming through on the RNAO Contact Us form. And a lot of questions about foot care, etc., and what was the appropriate approaches to take? What do I do if I'm a parish nurse or a nurse working in a faith community, etc.? So we decided that maybe the best thing to do would to be have a webinar for discussion and dialogue and find out what the issues were. So the first call we had back at the end of March, sorry, it was not at the end of March, it was the end of May, we had over 300 people registered, which was really many, many more than we had anticipated. And what came out of that was a direction to pull together some documents in some sort of a guidance document to help foot care nurses make some of the critical decisions that are necessary in providing foot care services, either currently, but more importantly, as we move through this probably long-term issue with COVID-19. And so immediately after that first meeting, we had pulled together a small working group of people that had indicated an interest in helping with this work. And so from the RNAO, there was Bev, Catherine, myself, and Melissa. And then you'll see the names of the foot care nurses that during the course of that first meeting said, yes, I'd be interested in helping out. So their names are listed there and the various sectors that they represent. So one of the things that came out of all of that was really a need to pull together a document, as I said, that would help direct nurses in terms of their thinking about practice, and particularly in the areas of foot care practice during this potentially longer term situation. One of the things we wanted to do today, because we are anticipating that we will review and provide you with an opportunity to get a sense of the final document, that this probably will be our last opportunity to meet in this forum, but we did want to bring together those organizations, individuals who we utilize some of their resources in the development of this particular document. So it's not meant to be those that are on the call right now are really those that are representing some of the associations that were included in our guidance document, but definitely not an inclusive group of everybody that might have interest in foot care nursing across the country. But I think we've got some very committed individuals on the call right now who are going to share their work with us. So what we thought we would do first, just as I introduced in the agenda, is have an opportunity for each of these groups to give us a bit of an update briefly about their organization, their mandate, and what they do. And again, this is to help you as foot care nurses think about where you might need to go in the future to help get some of your questions answered, but also to look for supports in terms of the professionalism of foot care nurses and being able to advance your practice. So with that, I'm going to turn it over to our team from the Canadian Association of Foot Care Nurses to speak about their work. And some of our groups have slides and some of them don't, and that's absolutely okay. But the real purpose of this is just an opportunity to share the mandate of the various groups and how they can support you in your work as a foot care specialist nurse. So I'm going to turn things over to our team from the Canadian Association of Foot Care Nurses, and I'm not sure who wanted to speak to this. Audrey or?
Hi, Heather. Yes, I am going to. This is Audrey.
Okay, good.
And Pat, I would encourage her to chime in if she we're a team and we work really well together. So
excellent. Go ahead.
So for those people who may not know about CAFCN, we are a national association who represents foot care nurses across the country, LPN, RPN, RN, NP, RPN in the psychiatric nurse, and we do have a few psychiatric nurses providing foot care in BC. So we are essentially an association for nurses and by nurses. So our executive is made up of working foot care nurses. We are a not-for-profit group. Our goals are to collaborate with health professionals across Canada and really promote optimal care and client outcomes among the group of healthcare foot care providers. That's podiatry, chiropody, wound care, and foot care. We have a national conference that we have well over 150 people come to every year. This year, unfortunately, we had to cancel that. It was in Halifax, but I just got an email that said Halifax has had 0 new cases of COVID-19 since June the 9th. So we are so excited for our colleagues in Halifax because they've had quite a spring with fatalities and horrible accidents and COVID. It's just been an awful time there in Halifax. Next year, we're off to Calgary, so fingers crossed that as a nation, we can get this COVID business under control. We also promote public awareness of the benefits of nursing foot care. I'm sure everybody on the call will be familiar with the fear that most of us are feeling in the oncoming tsunami of ulceration and potential amputation because of the holdup and the suspension of foot care during this pandemic. We also are facilitating the development and publication of clinical research. We have a nurse practitioner who is one of our Newfoundland advisors who has now just finished her doctoral dissertation. She defended that recently on getting clients to use the infrared thermometers you buy at Canadian Tire or Home Hardware to monitor their foot temperature and to initiate self-management protocols should the temperature rise, kind of keeping a wound preemptive situation there. And she's now moving on to yet another foot nursing research study, and we're very excited about that. So what we've really been working to do is, because we are national, we are really trying to provide navigational support for all our members across the country. Every province has approached COVID-19 very differently. Even the local health authorities within each province, I know in New Brunswick now there's Campbelltown nurses aren't even permitted to go in. You can't go into Campbelltown unless you live there because of the COVID-19 situation. So we are really relying on the provincial regulatory bodies as well as the health authorities to really direct healthcare, direct how they see their clients, how they see nurses moving in or healthcare providers even moving in and out of places. In Alberta, the situation was very, very tightly managed between the regulatory bodies, even with the long-term care home situation, and we have that same situation in Ontario. So I think, Heather, a lot of your calls may have come from members of ours saying, look, our association told us to call you guys. And so we are so grateful that you guys have done this. We are here to provide support to our members. We will not stipulate what our members are to do with regard to PPEs or how they function within their own businesses, within their own practices. That is for the individual member. And we have always supported critical thinking and really looking at each situation individually, because if I can go from one person to the next, if I'm a mobile foot care nurse, one client to the next will present different nuances of how I'm supposed to approach that situation. So we can't offer a blanket situation to how our nurses and our members are going to approach this. So for an Ontario initiative, it's wonderful. We're really grateful. So thank you.
Great, thanks, Audrey, very much. And I think, certainly as we were doing some of this work in investigating practices, et cetera, it was really very evident, sort of a range of different approaches, but not only that, certainly the different parts of the country and within the provinces themselves, as you've said, having different capacity and appropriateness for opening up different aspects of care and social services, as well as general community partners itself. So we appreciate
Yes.
your comments and glad you're able to join us with your team.
Thank
So
you. Just one more second. I just wanted to say that we do have a document that is a nationally applicable document that's the National Competencies for Advanced Nursing Foot Care in Canada that does speak to foot nursing practice as a whole. And in there are a lot of things that do speak to individual practice and how to connect that into their practice. So it is available on our website, and we can provide that link for you.
Okay, fabulous. We can put that with the notes for the meeting then today. That's great.
That would be great. Thank you, Heather.
Okay, absolutely. Okay, so I'm going to turn it over now to the Ontario Podotho Nursing Association. They have some slides, and Erin, are you going to speak to the slides?
Sorry, I had to unmute myself there.
No, that's okay. Not to worry. We're all getting used to this. Sometimes it takes longer to unmute than others, so not to worry. Can I manage the slides for you? Could just want to tell me when to go ahead?
Sure.
Okay.
So the Ontario Podortho Nursing Association, we are regulated healthcare providers, as everyone knows, and we facilitate the integration of Podortho nursing within the public healthcare sector. So our organization supports Podortho nurse members who in their career objectives by offering support. We create documents to assist our Podortho nurses in their business practices. And we also assist with providing education initiatives, so continuing education initiatives beyond their core nursing foot care programs. We are currently in the healthcare mainstream and adapt to support members as the scope of practice of Podortho nurses continues to evolve. We recognize that there are differences in regulations between province to province, and this is why our association formed. We've established our Podortho Nurse Core Competency Practice Standards and have a fairly lengthy document which we can also provide to you as well. And we also advocate for a required certification for our membership. And there's a couple of reasons why we're doing it. One of which is we've been engaged in conversations with insurance companies, and this has been a huge problem for foot care and Podortho nurses for a long time to gain recognition and coverage so that when their patients receive our care, they're actually able to be reimbursed for the cost of the care. So this has been a huge undertaking by our association, and we're happy to say that we now have one of the biggest insurance providers on board that will now be allowing Podortho nurses to bill for care. We are guided by nursing best practice standards with the College of Nurses. Podortho Nursing is a registered trademark title, and it's recognized by our governing bodies. So we've had lengthy conversations with the College of Nurses and practice consultants to ensure they are aware of who we are and what we do. And we aim to increase available services in the private healthcare sector. Next slide. So this is a statement that was provided in 2014 by the Health Professions Regulatory Advisory Council. So this was a stakeholder feedback on the model of foot care for Ontario. So the College of Nurses states that registered nurses, registered practical nurses, and nurse practitioners, collectively referred to as nurses, are regulated healthcare providers who provide foot care in a variety of care settings, long-term care homes, hospitals, family health teams, physicians' offices, and in communities and patients' homes and private health clinics. Nurses assess patients, provide preventative care, and educate and refer patients to other practitioners where necessary. Nurses also provide non-invasive foot care services such as clipping nails, repairing calluses and corns, debriding morbid tissue, treating ulcers, providing wound care, monitoring conditions of the foot. The big one here highlighted, prescribing and dispensing orthotics. So we just got permission to do that through insurance companies now, and wrapping and bandaging the feet. Next slide. So this is a guideline chart that our board has created, and this is a nice quick reference chart that discusses the scopes of practice and compares the scopes of practice from a Podortho nurse versus a chiropodist versus a podiatrist versus unregulated healthcare providers such as Podorthos. So you can see here The scope of a Podortho nurse is not much different than a chiropodist, and we're hoping to increase that scope of practice in Ontario moving forward. Next slide. So our association, as Podortho nurses, are aware of the particular ethical challenges in their practice and are committed to protecting the public and providing services in an environment that's safe, competent, evidence-informed clinic and business practices. So we have a lot of members that have clinics, or they go into the home or long-term care. So we have a lot of different members doing different things. So we set standard fee guidelines to decrease over and undercharging, considering costs to deliver optimal care and ensure the nurses' businesses remain viable. And that's a huge thing, especially when we're talking about infection control today and the costs surrounding infection control. I think we need to recognize that we need to charge accordingly. We have created ethical practice documents on our website. I just discussed the Podortho nurse core competencies and communication with the College of Nurses. We list many practice documents to support your practice to ensure you have the resources available. So this is under our members only foot tools section. So when you become a member, you have access to multiple documents, which includes navigating insurance companies and how to submit forms and things like that. Next slide. So I'm not sure if everyone is aware of this, and I just want to congratulate the foot care nurses and Podortho nurses across Canada and the province of Ontario. You can see just in Ontario alone, like these are statistics from the College of Nurses from 2017. There's between 13 to 2,000 foot care Podortho nurses in Ontario alone. And you can see here, there's only 650 chiropodists in Canada. And as we know, in Canada, the podiatrists are declining, so there is a need for foot care. Next slide. So the number of podiatrists have fallen in Canada. There's no podiatry school that has been established in Ontario, and no new podiatrists have started practice since 1993. So there's a gap between the demand of foot care services and the supply of regulated foot care professionals, and that continues to grow. So chiropodists have been unable on their own to satisfy the demand, and there's a growing shortage of orthopedic surgeons, especially regulated healthcare providers specializing in the foot. So nurses have risen to this challenge and moved into the vacuum by offering a range of foot care services. So congratulations to all of us. Next slide. So Sarah might want to take this over because this is her slide.
Hi. So obviously here with the OPNA, we're here to advocate that foot and lower limb care is as much of a preventive care and an active care. And by creating a nurse-led model of foot care, we're obviously promoting wellness. We're, as nurses, we're improving access to care through prevention and management. We're enhancing preventive care services and reducing the risk of illness complications. We're also, as nurses, we're known to adapt to the changing need of the population, and we've seen it gratefully with this pandemic, how we've been quickly shifting and adapting our care of essential versus non-essential care at the beginning of the pandemic. And obviously, as nurses, we're here to promote collaborative care with other professionals. Next slide. So as a Podortho nurses, we're focusing our care, and this is just a quick description of what we provide as Podortho and foot care nurses. So by performing medical exams and death assessment of different factors. So we really take in many factors in consideration, such as physical, emotional, social, psychological. We review our patient's medical care history. With that, we're able to provide a nursing diagnosis and adapt that to the nursing treatment care plan based on recovering and the maintenance goals of care. We're continuously evaluating and monitoring our patient treatment care plan, and we will be readjusting the care plan as needed. We're promoting health. We are promoting preventive care, and we are providing educational strategies to our patients. We're offering a systematic and holistic approach to delivering care, and that's really our base as nurses, is that we don't just assess the lower limb, but we really take the person as a whole, as an entirely. And then we also, as Erin mentioned earlier, we do promote continuous education, and with our background and our skills and our knowledge, so such as lower limb assessments, fall risk assessments, biomechanical exams, gait analysis, diabetes risk assessments, circulatory pathologies, infection prevention and control, wound care, and the list can go on because the scope is so wide. Next slide. This was just a quick, and obviously this we've established it with the pandemic, as some of us are delivering care in clinics, and we obviously want to make sure that we're delivering safe care in our practices. By delivering care in clinics, we're able to make sure that we have a better control of our environment, such as air quality. With clinic care, we're able to establish strict policies, procedures, and protocols, and have better access to infection control measures, such as having an area to remove our PPE safely, having access to hand hygiene at all times, and being able to disinfect our environmental services. And these are all required by Public Health Ontario. We have access to immediate equipment processing, as our clinics have in-house sterilization rooms. Obviously, by providing care in clinics, we're able to assure safety body mechanics as much for the practitioner, but also for the patient with appropriate equipment. And we're also able to assure patient confidentiality, as most of our rooms are private treatment rooms. Next slide.
Oh, there we go.
Oh, and I'll pass this back to Erin.
Yeah, just in closing, Podortho nurses are leaders in our specialized area of care here in Ontario, and we're here to help you achieve your career goals. And let's celebrate the Year of the Nurse and support each other in whatever we need to do to have happy, healthy careers and happy, healthy patients. Thank you.
Thank you very much to you both. That's fabulous. Okay, so now we're going to turn to Rami, and she's going to speak about her work with IPAC-Canada and the Foot Care Nurses Certification Board.
Hi, hello. Well,
Hi.
Thank you for having me again, Heather.
Yeah, no problem. Welcome.
I don't know if my speech will be as long as the other ladies, but I will try to make it brief about who we are. Basically, the Foot Care Nurse Certification Board is a group of foot care nurses or advanced foot care nurses who've gotten together, and our whole goal is to raise the standards and awareness of the role of the certified foot care nurses. So what we do, we provide a platform, we advertise their services, and we also do this by providing collaboration through supportive effort. Also, because we're all about the role of the foot care nurse, we know the complexity of the foot care nurse and in the service that they provide in the community, and especially with infection control. I have been very much instrumental in getting on the IPAC committee, because we know foot care devices have been associated with healthcare associated infections and outbreak. So I've been involved with both documents, that's the reprocessing of critical foot care devices, as well as the standard of practice. That's the practice recommendation for infection prevention and control related to foot care in healthcare settings. So when we look at the foot care nurse and the services that they provide out there, although the foot care nurse, they provide assessment, treatment, we want to raise the standards. And at this time, a number of insurance companies have already recognized our foot care nurses and are providing they're basically providing support to their care, and they're paying for clients who come through with health insurances. We feel that the foot care nurses play a very, very important role in the whole healthcare systems Canada-wide. And what we would like, our goal is to raise the bar, and also by having them not only be all certified, but certified to a standards that integrates infection control practices. And this was why the board came out with the COVID returning back to work for the certified foot care nurses. So what we looked at pre-screening of the clients that related to symptoms prior to their foot care appointment and treatment. And in the pre-screening, they need to perhaps do the pre-screening beforehand, before they go into the homes or before they go into the retirement homes or the mental health setting or into the client's home. But because a lot of the certified foot care nurses or CFCNs are mobile, we want for them also to, as they're going into these clients' homes, to ask specific questions in their screening, in particularly related to who, if the client has been exposed to the virus. Are there members in the household who are in quarantine? Before they even provide these treatments. We also ask for the nurses to also not only to use their judgment, but also perhaps have the client sign a consent as well. We know the foot care nurses also provide assessment, and because the foot care nurses are in close proximity to the patient or client, consumer, we want them to use full PPEs. And we do this not because of the foot care devices that's been associated with healthcare associated infections and outbreak, but we want them to be aware of the tools that they're using, as well as we want, when necessary, for them to mitigate so that they don't get COVID or they don't provide COVID to their clients. So what we also suggest is, when necessary, for the foot care nurse to provide treatment in a standalone clinic. And again, to use the single-use disposable tools. If they are using the reusable tools, to clean and sterilize these tools as per IPAC-Canada position statement on reprocessing of the critical foot care devices. We know sometimes as well the foot care nurses may not, they may be using reusable tools, but they may not have an autoclave or a steam sterilizer. So we ask for them to have that reprocessed through a third party. So we're okay with that as well. So the wearing again of the full PPE is very, very important. So what that includes is the foot care nurse using an exposure gown, face shield, mask, and when possibly even a hair net. We have to be aware and picture the service that the foot care nurse is providing. And the tools in itself, if the foot care nurse can use a single-use disposable tools. So those tools can be disposed in a sharps container, or if they're re-cleaning these tools, have them in an enzymatic type of container that is seal-proof before they get home and start sterilizing, or have it reprocessed in a third-party facility. The PPEs that the foot care nurse is wearing, we want those to be discarded in a plastic seal-proof bag or bin liner, and leave it at the client's home. We know that many foot care nurses are providing care, and as they're providing care, we want them always to keep at the forefront of not only the tools, but also their practice technique can actually harm the client. So we want for them to be very, very much aware of infection control. And this is why we also have as well the core competencies of practice for the certified foot care nurse. And we have these practices in place because we focus and we hone in a lot on infection control. Yes, we know it's going to cost a little bit more for the foot care nurse, but we want to raise the standards. So as a result as well, with our certification process that is in place, any foot care nurse that is providing training, we want for them, if they can, to get their program accredited by the Canadian Nurses Association. So this is where your program will be peer reviewed, looking at best practices today. So we very much so do a lot of collaboration, and we're open to working with any foot care nurse educators out there that would like to get their program accredited with the Canadian Nurses Association, because we hone in a lot on the importance of infection control, not so much cost.
Okay, good. Thank you, Romy, so much. And I think some of the things that you've mentioned will become very clear through the discussions that we have following. And again, I want to just thank you and everybody else for your very clear presentations and your consistent desire to enhance and support the practice of foot care nurses in Ontario and in Canada. So what I'd like to do now is go through the results of our collective work. I'm just keeping an eye on the time here. It's about 20 to 2. And what I'd like to do is just kind of quickly take us through the document that we've prepared. There may be some questions in the chat as we go ahead. So what I'd like to suggest is that as I'm sort of sharing the document that we've developed collectively, that we maybe take an opportunity as we go through each section to see if there's any questions that our panel might be able to respond to. And then I do need to just make sure that we have a few minutes to wrap up just before 2 o'clock. So thank you all so much for sharing your comments. And again, I just want to highlight that the document is called 5 Essential Considerations During COVID-19 for Foot Care Nurses in Various Settings. Oops, oh dear, I went too fast there. And we want to really talk about the determination of essential versus non-essential services, completion of the process of pre-screening. And again, this is in the context of where we are right now, where we anticipate being, and recognizing that it may be some time before everything is sort of back to normal again. So a selection and acquisition of appropriate PPE, disposal of PPE and instruments, and disinfection of foot care equipment, and then some comments about accountabilities and practice considerations. So that's sort of the elements of the 5 essential considerations that have sort of evolved as we've had that first meeting at the end of May, where many of you were on the call along with many of your colleagues asking lots of questions that helped guide the gathering of information, the small working group that we had at the beginning of June, and the session that we had together June the 3rd, I think it was. And then again, sort of the evolution of this particular document to where it is right now. And I'd really like to acknowledge and thank Bev Faubert, our long-term care best practice coordinator, who's really taken the lead on pulling this all together. So what I'm going to do now, let me just make sure I'm not, yeah, so I'm supposed to stop sharing this screen and start resharing another screen so that I can share the document with all of you. So here we go, and hopefully you can see it. Can you see the Word document on the screen right now, colleagues?
Yes.
Yes, okay, so let me just see if I can make it any bigger. I think I can do that by doing this. Let's just see. Okay, but is that too big now?
Yes, it's a little big.
Okay, so maybe we'll just scroll through here. So basically, is that better, Melissa? Can you sort of see it basically on the screen now?
Yeah, it looks good. You might be able to expand the screen too at the top.
Yeah, I'm trying to, but it doesn't seem to want to let me do that for some reason. Let me just see here if I could, you know what, maybe I move everybody out of the way. There, how's that?
Yeah, that looks very good.
Okay, so when we put this together, we were again really thinking about where do nurses work, foot care nurses work, congregate settings, long-term care homes, clinics, whether they're home-based or community foot care clinics, and community-based home care visits, whether they're in agencies or independent practice. So because of that, and as I think all of our speakers mentioned, because of the range of sectors and places that foot care nurses work, there are some challenges in making some just definitive statements about any of this, which adds to the challenge, but also adds to the, really reinforces the need for really strong critical thinking skills as you're making some of these decisions and determining what the best for your particular practice situation. So we did just want to acknowledge that what this information is current as of June the 18th when we searched all the links, but that it will need to be considered as things move forward in Ontario. There may be some changes and new documents that become available that would supersede these particular ones. So we looked at this determination of essential versus non-essential services, and this is a challenging one, but we looked at the documents from the Ministry of Health, operational restart for the healthcare sector that was dated May the 26th. That's specific to Ontario. And again, you really need to check the directives, memorandums, and other resources regularly to make sure that we've got the most current one from the Chief Medical Officer of Health. The Ministry of Health also has produced a document, Consider Risk of Harm to Patients, Residents, and Clients. So minimizing harm to patients. The Canadian Association of Foot Care Nurses has a document that talks about essential apart from emergency cases, etc. So again, the link is there from our colleagues that have been on the call with us. National Competencies for Advanced Foot Care in Canada, again, another national document. Foot Care Nurses Certification Board, again, really focusing on patient safety. And again, some recommendations for certified foot care nurses working in all settings. Then again, our group from Ontario with some resources and tools to help make some distinctions between essential and non-essential Podortho nursing services. So that's the first step of all of this. And I'm just going to stop and see, are there any questions, Bev and Catherine, in the chat that we should be addressing at this point in time? Any questions? Or are we okay to move ahead? I see one question that people are asking about when the document will be available. We're sharing it with you today, and after today's meeting, we will post it on our website so that it's accessible to all of you. And if you'd like, we can send the PDF version out to those that were registered for today's call. I'm sorry, Bev, I think I spoke over top of you.
No, you said exactly what I was going to say, Heather.
Okay. All right. So, so that's the first step is, where are we ready to reopen and what kind of practice do I have, and or what is the next step? So the next step is looking at pre-screening. And so a number of documents from the provincial government have talked about pre-screening or screening of for COVID-19 for practitioners in different sectors. And so this first document from the Ministry of Health talks about guidance for screening, and it's the basic information really, and contains recommendations for screening. And it's not intended to take the place of medical advice, diagnosis, or treatment. So it's strictly active screening. Now, the second point of all of this is a point of care risk assessment. And again, this is in the directives from the Ministry of Health, and being able to assess the task, the patient, and the environment. So again, thinking about utilizing critical thinking. What is the task that's required? What is the status of the patient, and or maybe potentially the family members within the home where the care is being provided, which kind of links to environment. And so a point of care risk assessment is the first step in routine practices, which are to be used with all patients. And again, I think this is part of what Rami was speaking to, is the challenge of active screening when many of your clients are not in front of you. And so how do you actually go about active screening? And so I think there's some, I know that there's some descriptive of active screening practices within this particular guidance document that we're looking at. That ideally could be over the phone or online prior to the visit actually taking place, whether that be a clinic visit or an in-home visit. Others have done screening sort of on site. But again, that's an important step in maintaining the requirement and the alignment with the ministry's directives. The next document offers the symptoms which have been most closely associated with COVID-19. So again, this is a challenging area because we all know about asymptomatic transmission, but certainly this particular document is the one that is guiding the province in terms of the province of Ontario in terms of symptoms of COVID-19 that can help guide some of that screening. The Canadian Association of Foot Care Nurses, again, has a statement on their website, which you can refer to in terms of those with COVID-19 and their eligibility for care at this point in time. And then the Foot Care Nurses Certification Board also has some statements related to this whole practice of pre-screening and ensuring that there may be a need to assess others in the home should the individual be residing with others who may pose in quarantine for COVID-19. So the next step of all of this is the selection and acquisition of appropriate PPE. And again, it's really important that you seek advice from your health authority, IPAC-Canada, or your regulatory bodies if you're outside of the province of Ontario, as these directives really do supersede any professional association's advice. So the RNAO is not making a statement on what PPE you should be using in any given circumstance, we're taking our guidance from these various different resources, in particular IPAC-Canada and the Ministry of Health and Public Health Ontario. So in this document, we've gathered together resources for you, and this particular one, practice recommendations for infection prevention and control related to foot care and healthcare settings. And this is the document that Romy was speaking to earlier, and her involvement in helping to develop that particular resource. Actually, I'm sorry, I should have stopped after screening to see if there was any questions. Catherine, are we okay?
Hi, Heather. I'm just reading through some of the chat box, and I don't think there's been any questions specific to screening.
Okay, thank you.
Just to say that OPNA has created a one-page decision tree for screening, Heather, and I think that was something we're going to include as well, right?
Yeah, okay, yeah. And I've just been reminded again, and I'm sorry that I was trying to use the word treatment instead of services, so I have to be more cautious with my language, so I appreciate that reminder. Okay, so let's move on then. So we've talked about the IPAC-Canada resource. Public Health Ontario also has recommendations for use of PPE for care of individuals with suspect or confirmed COVID. And of course, this is a very specific circumstance where you actually are suspecting or the individual has COVID positive situation, and you may or may not be providing care in that circumstance. For the Ministry of Health, Directive number 1 for healthcare providers and healthcare entities. And again, this is very specific direction that may be superseded by some of the requirements of your day-to-day use of PPE. Certainly there are some ranges of that specifically for foot care nurses in terms of your daily practice that you would be utilizing anyway. And then again, another number of resources here from Ontario Health related to PPE in different settings. So inpatient facilities, primary care and clinics, assessment centers, long-term care, home and community care. So again, that might provide you with some guidance in terms of the use of PPE in your specific practice area. And then again, some resources on the use of surgical or procedure masks and strategies for conserving personal protective equipment. And that's, something that has been really necessary as we recognize the limitations of our supply of PPE, but also in the go forward, really thinking about how do we make sure we're utilizing it appropriately and conserving it in a way that's responsible for the health system overall. So again, then we've got some resources from Public Health Ontario, Principles of Universal Masking, and how to do that. And there's some actually good scenarios and examples provided in that document. And then now I think Canada Public Health, so this is the Government of Canada. Again, and it's specific to COVID and specific to home care providers. So again, for those of you that are working in the home environment, that might be of particular interest. So there's some specifics there as well related to the whole issue, just as Romy was speaking about donning and doffing, inside homes, outside homes, and safe disposal to be able to minimize contamination. And that, obviously safe donning and doffing goes everywhere, but there's a particular challenge when you're working in home and community care and you're needing to either leave it behind or take it with you in transit, which causes another challenge. And so again, we've got some other resources here, Public Health Ontario, the risk algorithm to guide PPE use. So these are a lot of resources here. There's a lot of information, and thanks again, Bev, for really combing through these tools to help identify the most appropriate ones. And then there's resources here for acquisition of supplies, that companies that sell PPE that's been approved by the Government of Ontario. So I'm going to stop there and just see what questions there are coming up in the chat. Or Bev, you had a comment?
I just wanted to comment that there's always been a lot of discussion about cloth gowns and how easy they are to sterilize. And I just want to reinforce that in my research, it wasn't so much about the choice of gown that are easy to sterilize, but COVID is an organism that travels through moisture, So your gown has to be moisture proof. And I think some of the caution that I've read all along is that there's a difference between a surgical gown and an isolation gown, and that isolation gowns are moisture resistant. So if you are in contact with anybody that may have COVID and you're not aware of it, you're more protected with that isolation gown than you are with a cloth gown because moisture can penetrate. So even though they're easier to sanitize and you can reuse them, they're not, sometimes that choice of cloth gown isn't the best choice. So that's why we put in here, you know, to really consider some of those PPE companies that are approved for use in Ontario.
Good, thanks, Bev. And there's some comments in the chat I'll just direct people to as well, related to the different types of gowns. So thanks for helping support each other with your various questions in the chat. So I'm just keeping an eye on the time. So disposal of PPE and instruments and disinfection. So this takes us to our next big category. So there are a number of resources here that we'd like to draw to your attention. So the Canadian Standards Association on practices on medical device reprocessing for foot care and specifically IPAC-Canada position. And again, this is one that Rami worked on, a statement of reprocessing critical foot care devices. And again, and this isn't specific to COVID, I don't believe, is it, Rami? It's more related to the appropriate and safe practices overall. Is that correct? Oh, maybe I've caught her. Okay, I'll go in. Sorry, Rami. And then Public Health Agency of Canada.
Hello,
yes, sorry, then we can hear you. Yes, I'm just thinking that this particular document isn't specific to COVID-19, but it's generally really about the appropriate foot care disinfecting or reprocessing of critical foot care devices, period. Is that correct?
Absolutely, as well as practice too.
Yeah, okay.
In addition, because of COVID, what we have, or what the Foot Care Certification Board have added, because of the nature of COVID, is to also use that disposable booties, the blue disposable booties, that when you go into a client's home. And also,
and that would be particularly for a client's home rather than in a clinic or another circumstance.
That's right. Yes, yes,
okay.
In the
Thank you.
home or in the settings, because of the nature of the virus. Because the foot care nurse can actually carry it with her when she leaves that client's home. So on the shoe. So that's what we want to add. And if necessary, too, the little bouffant disposable caps. And I notice a lot of people are looking at wanting to know where they can get PPEs from. There's a lot more places now that are selling the Health Canada approved various PPEs. But what I don't want to just promote one company, so I'm not going to say, but there's lots of resources now with getting the appropriate PPEs.
Yeah, great. And there's a nice link on the website, which is going to come up next or very shortly in this section, that can help guide you to a variety of organizations or companies that are selling PPE that have been approved, which is really important. So again, we're going back to the interim guidance for home care settings around guidance for handling of equipment and laundry, leaving the patient's home, for example. And then specifics to coronavirus from Public Health Ontario. This is more about general public setting disinfection. And then the reuse of personal protective equipment. And this is more about some of the emerging literature rather than a specific directive. And so there's still a lot of information we don't know about this. So we're not proposing that you should be reusing personal protective equipment, but just know that there is emerging research in this area that is being looked at all over the world. Now, Bev, I think there used to be a link here to the acquisition of PPE, and I don't know what happened to it on this thing. I think I might have deleted it by accident. Because that was where it was, right? At the end of this section?
Yeah, but I thought I saw it earlier on, Heather. I think it's there and you...
Okay, just got moved about a bit. We'll have a look at that before we post it or send it anywhere.
I think it got moved up.
Okay, all right, that's fine then. And then finally, accountabilities and practice considerations. So the CNPS has some resources about foot care nursing during the pandemic that you might want to have a look at. And there's specific questions and responses from them. That's the Canadian Protective Nurses Society. Sorry, Canadian Nurses Protective Society, yes, CNPS. SP. Yeah, that's backwards. Okay, we'll fix that. And then the Canadian, again, being able to look at 6 considerations for independent practice during a pandemic. So again, these are as some reflections for yourself in terms of a practitioner and what you should be feeling that you're well aware of during any kind of a situation. This is probably most of ours, well, if not all of our first pandemic. So, but these are some things to think about. So that is the guideline document, or the guidance document that we've developed based on all of the input from many of you, your questions that you've asked during the course of our work together, the last 3 webinars, our small working group, and of course the contributions that that our associations have made to the work that we're doing overall. So I'm just going to turn us back to Melissa. Can you see the slide deck now again?
Yes, I can see it.
Okay, good. So I'm just going to check. We've got just a couple of minutes left, but I think a lot of the questions have been responded to in the chat by other members of either the panel or others who have been able to help each other out. So is there anything outstanding, Bev or Catherine, that we need to respond to before we wrap up the call today?
Not that I can see, Heather. Thank you. I'll keep looking though, and if anything does come up, I'll make sure to unmute myself and let you know.
A common comment is that all of these sites that are included in this document are constantly being updated as things are changing. So I would just suggest, even though this is relevant for today's session, within a week or 2, you may see some of those medical directives change, or so just, I want everybody to be aware of that.
Yeah, and I think we've stated that at the top of the document, but it's absolutely worth reiterating that, as we all know, things are happening on a daily basis, maybe not as intensely as previously, but definitely happening regularly with new information, new opportunities, etc. And so these documents that we provided guidance on are available to you, but certainly you want to make sure that you're using the most current one available, and the links should take you to those, but obviously you want to just ensure that you're using the most current version of those documents. So with that, I think I'm going to wrap up. I just want to thank all of our panelists for their contributions today from all of the associations. We greatly appreciate your time, energy, and expertise that you contributed to this work. We're pleased that we're at this point. We feel that from RNAO's perspective, we've achieved our goal of being able to develop a document that can help provide guidance to nurses working in this particular area, not to take over the responsibilities and expertise by any stretch of those associations on the call, but we were recognizing that we were getting a lot of requests and wanted to help support nurses working in the field. So in terms of next steps, this will be our last forum in this last meeting in this forum, I guess is what I'm trying to say, but we will include all of the archive forum recordings and resources that we've circulated previously are posted on our website, so they're available for you to access. We'll have another read through this document just to make sure everything is final. We made some changes over the weekend and again this morning, and so we want to make sure it's as current and up to date as it possibly can be before we circulate it to you. But it will be posted on our website on those events page with the Forum Foot Care Nurses. I think we'll also post it on our COVID resources page. And by all means, we'll send it to you in a PDF so you'll have it available to access. And if our associations would like to circulate it to their members, we'd be happy to have that happen. So with that, I just want to thank everybody so much. See if anybody else wants to make some just final closing statements or say goodbye before we wrap up.
Hi, Heather. This is Audrey from CAFCN. I did want to let everybody know that the Canadian Standards Association document, the Z314-18 document, which is medical device reprocessing, has been made for no charge availability in a read-only format for everybody. So their response to the pandemic was, here, please have this document. Usually it's about $600 to purchase, and they have made the read-only formula no charge. So if anybody goes to their page, they can download the document there, or not download it, they can read it there.
Okay, excellent, Audrey. Thanks so much for that. That's good information to share with everybody. That's super. So with that, it's 2 o'clock or just shortly thereafter. So I'm going to wrap up the call. And we can add that. We'll check to make sure we've got the right link. So maybe we can include that in our document. We'll make note of that.
That link is there. I'm sorry,
Yep.
I see people asking for that link.
Yeah, they are.
And it's
Yep.
included in that document. So
okay,
I
super.
want to thank Audrey for forwarding some awesome resources as well.
Yeah, excellent. So we've got that there already, which is super. And so with that, I'm going to thank everybody again on the panel and all of you who made a commitment to being with us over these last 3 meetings. Again, I really, we were totally overwhelmed with the number of people, but also the support that you've been able to provide to each other in the chat, and look forward to opportunities for working together in the future. So thanks very much to you all for your time today. Have a great afternoon, and we'll look forward to opportunities to meet again in the future. Take care.
Thanks for having me, Heather. Thank you very much.
Okay, you're more than welcome. Delighted.